Good morning, everyone. Thank you for joining us this Thursday. We wanted to make sure you had plenty of time for this Memorial Day weekend for all of your barbecues and Memorial Day parades and other things that you might be doing. So we are holding this webinar a day early, and it turns out it is a very eventful week and an eventful day. So we have a lot to talk about, and we are going to condense it into 1 hour this time. We'll start off with just one brief, quick little piece of candy at the top of the hour. Last week we talked about the importance of people from a lot of diverse perspectives, all writing and connecting with local media and talking about how important Medicaid is. And this was a great example that appeared in the Sheboygan Press, where leaders from several different community groups came together and issued and did a joint opinion statement that was published. I think this is a great strategy to show how many ways Medicaid cuts impact the places and the people that we know. And so keep it in mind as an example, because I think with the events of this week, we are going to have a lot of opportunity and a lot of need to keep making the case about what these potential cuts could mean to the people who we know living in our communities. So, what has happened? Lots. As of this morning, at about 6:30 Central Time, the U.S. House has passed the reconciliation bill as amended by the Rules Committee. The Rules Committee began its hearing at 1 a.m. on Wednesday, and by 9:30 p.m., they had adopted an amendment that would deepen the Medicaid cuts that were already proposed in one significant way. And there are still some changes that we are working to understand what they mean. At night, they then referred the amended bill to the House, which began debating it and officially moving it towards a floor vote at about 2:30 this morning. And 4 hours later, the House has passed its version of the reconciliation bill. It was a party line vote, which means that at least Wisconsin has a delegation of U.S. House members. The Republican members of Wisconsin's delegation all voted yes for the bill, and that means the Democratic members voted no. So the bill passed 215 to 214, very close vote, but it has passed, which means that now it will move to the U.S. Senate. No changes have happened yet. The U.S. Senate would have to agree with any of the items that have been passed to the House bill. The Senate can change anything in that bill and edit it and send it back to the House for their approval. So we are far from done in terms of advocating of for or against ideas that are in this bill, but this is a major step that has been taken this week and on the timeline that the House Speaker intended. As of tomorrow, all of the members of the U.S. Senate and House will be returning to their districts. So our Wisconsin members will be coming back to Wisconsin for the Memorial Day recess. So they will be in town essentially through next week. The Senate now takes over the reconciliation bill process. They will come back from the Memorial Day recess, and I have to apparently edit my presentation a little bit more. I was scrambling on edits at like 8:30 this morning. The House has passed the reconciliation bill, so now the Senate can begin its work to edit that bill. National advocates still believe that the Senate is going to start with what the House passed and amend that rather than working on its own separate piece of legislation and going through committee process. So you can see on this timeline that I have marked off all of the things that say recess are when members of Congress are coming back to the state and have time off in district. And maybe you get out your phones and you put those dates in, because these are all going to be opportunities to engage with members of Congress, especially our US senators who are now more focused on this bill, about your concerns and ideas that you think should be changed in those bills. In terms of overall timeline, the Senate has a kind of a deadline in mind for when it wants to be done with its edits and pass its version of the reconciliation bill by the full Senate and then send it back to the House for approval. Because the Senate and the House have to agree on the exact same language for this bill to become law. So if the Senate makes any edits, that means the House will have to come back and agree to them. And the Senate has decided that their hard deadline is the August 4th recess, which makes sense because the debt ceiling, which this bill would raise, needs to be raised before the government can't afford to pay its bills. And the deadline when people think we will not be able to pay our bills has been moved up to August. So the Senate has that in mind as a hard deadline by which it has to get this reconciliation bill passed before we default on our debt. So there are a number of amendments to the bill that have happened. The major one that House fiscal conservatives wanted was included, and that is to implement the prove you're working or exempt requirements much sooner than the original bill wanted to. So the changes that were made would mean that those requirements states would need to implement those requirements at the end of 2026, by December 31st, 2026, as opposed to 2028. So it really shortens the amount of time that states would have to figure out exactly how they do this and have everything set up so that people know what to do and can do it. Many watchers believe that when you do something much sooner, that will end up saving more money, because the risk of people losing Medicaid coverage, which is how that provision saves money, it goes up the sooner that you do that. The Congressional Budget Office this week released an updated estimate of what they thought each of the items in the bill would save, would reduce in federal spending. And this estimate will change because the version of the bill that they did the estimate on was the version that was passed before the amendment happened last night. So the big news here is the cuts to Medicaid went up. So the original estimate, the initial estimate that they made was there was $715 billion in cuts to Medicaid. That has been raised to $790 billion instead. The Medicaid cut that saves the most money out of the whole list of items that impact Medicaid is that prove you're working or exempt requirement. That's what it reduces the federal Medicaid spending the most, and it would reduce the amount of federal dollars by about 279 billion. There are also some very significant cuts to the nutrition programs, and most of those cuts are coming from SNAP or food share. A lot of the savings that the federal government is claiming for SNAP is really coming from making the states pay for a lot of things that the states do not have to pay for now. That's called a cost shift to states. So the federal government is claiming that it is saving money because it's not spending money that it normally would, and it's telling states, you have to spend the money that we would have already. Okay. So we're going to go through both the SNAP cuts and the Medicaid cuts, just so people have an idea of what is in the bill. This is a big change. SNAP and food assistance right now is 100% federally funded. So this bill changes that. It requires all states to pay for 5% of the cost of the food assistance that is coming into the state in order to get the federal food assistance. It's much like the match requirement that we have on Medicaid and other programs. This is the first time there would be a match requirement for SNAP. And states are guaranteed to have to pay 5%. But then the bill says if you have too many mistakes, if you overpay too many people, then you have to pay a higher match depending on that error rate. So Wisconsin has a low error rate at the moment. So we would probably be in the 5% range, but understand that if you have too many mistakes, you might have to pay a 10%, 15, 20, and up to 25% of the total cost of the food assistance in order to get that assistance. Wisconsin last year received about $1.36 billion in food assistance. 5% of that, back of the napkin math, is about $68 million. So that $68 million per year is a cost that the state doesn't have to pay now that it would in the future if this bill goes into effect. There are some other changes that are important here. The error rate, which becomes important in terms of how much the state has to pay for match, the bill changes how many mistakes you can have before it doesn't like it very much. And it changes the tolerance down to 0. At the same time as it also increases and broadens the existing work requirements for SNAP program. Now more people would be subject to those requirements. They are increasing the age range of who they consider working age to be 18 to 64. Our current SNAP program in Wisconsin considers age 18 to 49 the working age, so quite a big difference. It also says that people who have dependent children who might be exempt from those working requirements, they are changing the age of a dependence and reducing it from 18 down to 7. So that would mean that many more people would be required to either prove they're working or exempt from working under SNAP. That probably leads to a greater workload for the state because you have to do more things for more people. The bill also changes the amount of support that the federal government provides states to run the program. Right now, Wisconsin gets 75% of the costs that it takes to run the SNAP program paid for by the federal government, and then they put in the remaining 25%. This bill would reduce that 75% from the federal government down to 50%. So again, another increased cost for the state. It also makes it harder for the state to waive the work requirements for people. Many states, including ours, are fairly generous with their waivers and leave them in place for a long time. The policy idea behind that is to make sure that food gets to as many people who need it as possible, that we're not creating a barrier to people accessing the benefits that make sure they're not hungry. This bill really restricts when states can waive those work requirements and for how long. Now, under the provisions of this bill, a county would have to have an unemployment rate of 10% or higher, which is very difficult to do. And the waiver wouldn't be able to stay in place for longer than a year. So lots and lots of changes to SNAP that really increase the costs to states and make sure and give states lots less flexibility about how to run their programs. To give you a sense of, SNAP in Wisconsin, this is from our friends at the Food Research and Action Center, but it has some kind of nice statistics on it. We are paying attention to this program because so many people with disabilities and older adults use that program. And about 2/3 of the people who are in SNAP are also in Medicaid. So cuts to both programs will impact some of the same people in slightly different ways. About 45% of the folks who have a disability, and you can see that it helps a lot of people in Wisconsin. This is kind of a summary of what those SNAP changes make. I won't linger too long on here, but in terms of, does this create a hole in the state budget, which we have talked about a number of times with if you reduce federal spending for programs, about 1/3 of our state budget is federal dollars. So if the federal government decides it's not going to pay for some things and says, states, you have more things you have to pay for, that becomes something that we would have to do in future state budgets. And there's some pretty significant costs that states are being given to continue running SNAP in the same way that they have been. So Medicaid cuts, we have talked about many of these before. This is a list of some of the major ideas that are included in the reconciliation bill that just passed. Again, the prove your Medicaid does not have a prove you're working or prove you're exempt requirement now. This would make states have such a program, and the bill would define who has to participate and who in kind of the broad categories of who is exempt. But there's a lot of things that the federal legislation doesn't tell states in terms of how to run, how to run that different thing. Another change in this bill is that people who are in Medicaid now, this new requirement to either prove you're working or prove you're exempt would apply to you. So if you are renewing your Medicaid coverage, this would be yet another thing that you would have to prove in order to renew, in addition to all of the things that you do now. This bill also makes a change that says if you are a new applicant, not only do you have to prove that you're eligible, so all of the same income and asset and other types of information verification that our state does for every person who is in Medicaid, all that has to happen. And you also have to prove that you are already meeting the 80-hour community engagement requirements, that's what they are calling the work requirements, is community engagement, or that you are exempt from those requirements before you can get in. So it is adding another basically test of eligibility before somebody can enter into Medicaid. It's unclear what it means if you can't, if you are not meeting that 80 hours of community engagement. It does seem like that is a barrier to getting into Medicaid under this bill. Folks that lose their Medicaid coverage because they haven't done enough community engagement would not be eligible for the subsidies if they were trying to get an ACA marketplace plan under this bill. So this is kind of all parts of the same idea of creating a lot of paperwork and process, all designed to make sure that people are meeting or are exempt from a work requirement, and putting in some consequences if they aren't meeting those requirements. Some of the other changes that are in the bill that I think impact this state, decreasing retroactive coverage from 3 months to 1 month. That means if you're in Medicaid or you're not in Medicaid right now, but you're eligible for it and you're accruing like medical or other bills. Right now, Medicaid says, okay, as soon as you are in the program, we'll look back the last 3 months and cover the bills that you had. This shortens it to 1 month, which can be really important if you've had high bills in a long-term care or rehabilitation or a hospital setting. So a lot of folks are keying in on that shorter time frame, means that potentially people could be caught with bills they can't pay, or hospitals could be caught with uncompensated care. There's also some other changes that again increase administrative work or costs for states, or change how states can spend, in some cases, their own state money without penalty from in the Medicaid funding. The amendment that I mentioned that the Rules Committee took up Wednesday night does make some changes that deepen the Medicaid cuts, specifically implementing the prove you're working or exempt requirements sooner. But it also makes some changes that impact our state specifically. We are one of 10 states that has not expanded Medicaid coverage to people who make above 100% of the federal poverty level, but less than 138%. Expanded under the Affordable Care Act is how a lot of people say it. And this amendment would make it less desirable for states that haven't expanded to do so. So that specifically is intended to impact states like ours. Kaiser Health News did an analysis, and this is again based on the version of the bill that has, as it was on Monday, not as it is amended today. But it gives you a good picture that every state is really significantly impacted by the menu of cuts that is included in this bill. And while Wisconsin is on the low end, you can see us down here, kind of fourth state from the bottom. That doesn't mean that we don't have any impact. It means that our impact is less relative to other states. And because there are so many items in this particular bill that really target states that have expanded Medicaid under the Affordable Care Act, you can see that states that expanded their coverage to include more people in Medicaid and who may have Medicaid, maybe Medicaid is serving more people, or it's a bigger part of their budget, might be more impacted than Wisconsin. But still, even under this initial analysis that Kaiser did, if you go to that site and kind of look through some of the tables, the bill as it is, as it was on Monday, would reduce Medicaid spending about 9% per person and work out to be about a $400 million per year cut to federal Medicaid spending coming into the state. So that's over a 2-year budget period, 800 million less than we would expect today if this bill would pass. And they do estimate how many people who have Medicaid now would lose their Medicaid coverage. And in our state, depending on whether you look at a high-end estimate or a low end, that works out to about 66,000 to 83,000 people. So pretty significant. Kaiser did a separate piece as well that looked at all of the policy ideas that were in the version of the bill Monday and really said that these spending reductions are coming from ideas that make it harder to get in or stay in Medicaid, specifically work requirements, but also things that make determining eligibility less easy. All of these savings are from increasing paperwork, which increases the risk of mistakes and increases the risk of people losing their coverage because of those mistakes. They've done a lot of things in the last week. Kaiser Health Foundation, again, they did some estimates, and this analysis doesn't include people over age 65. There are a lot of people in Medicaid who are over age 65, but that idea of, well, if people lose that Medicaid coverage, what happens? A lot of people do end up with a gap of being uninsured, which means if something happens in that time, they don't have the ability to cover those bills, and it becomes a bigger cost for the health system. And frankly, people who have private insurance are asked to pay more to cover people who don't have insurance. But the other piece is that a lot of the people who lose Medicaid coverage are not losing it because they're not eligible in terms of asset and income requirements. They're losing it specifically because the paperwork is too hard or they made mistakes, and they end up back in Medicaid eventually. So I think these graphs kind of show that the policy itself is increasing the amount of risk for people to end up temporarily uninsured, but it is not necessarily resulting in people who are in Medicaid now getting a different kind of insurance because their situation has changed and they've improved their lot, so they're no longer eligible for Medicaid. So what kind of problems would some of these provisions create for states? We've talked a lot about budgetary problems, but there's also a lot of challenges when you have a new idea that you're not doing now. That means states actually have a lot of thinking work that they have to figure out. And I'm going to focus on the prove you're working and exempt requirements, because that is a huge process that has to work right off right off the bat for 1.2 million people who are currently in Medicaid in Wisconsin, and anybody applying to get in who's not already there, right? So you've kind of, you have this bill, whatever the final product is, if there are changes that impact Medicaid, that means our state Department of Health Services has to figure out what does it mean for how we do things now, what needs to change based on what Congress has done. And there are lots of changes that might mean the state has to change how they do things. They may need to change, add more things for people to do. They may need to communicate very clearly what different changes people have to make, and communicate all of those things to participants. A lot of the items that are in this bill might mean there is more work, and they may need more workers to do new tasks. it will mean they need more money to pay for that extra work or new administrative costs. And maybe they get that funding or maybe they don't. It could be that you have more things to do with the same number of people, which will make it much harder to do everything that needs to be done correctly and on time. And there could be, overall system like technology and computer things that need to be changed to make sure that the state is in compliance so it doesn't lose money or get penalized or prevent, mistakes that could lead to issues that the state would like to avoid. Just thinking about like the prove you're working requirements or exempt, there are a lot of decisions that states will have to make in a very short amount of time. If you think about, having to be ready to implement a entirely new system for 1.2 million people by January 1st, 2027, we're already almost in June of 2025, and we don't know what the final details of the bill are because it has not passed and been signed into law. So things could still change. But just to kind of put you in that framework of what does it mean to have to do, think about doing something totally new very quickly. These are all of the types of decisions that states have to figure out in a very short amount of time. How often do we want people to prove they're working or exempt? What counts as documentation to prove that you've met the requirements of community engagement, either working or school or job training or volunteer activities? Who fits or doesn't in exemptions, and how do people verify that they are exempt? What's the process for people who aren't in Medicaid already? What do we need to do for people who are renewing, who already are in Medicaid already? And there will be people who don't meet the requirements, which means that we have to figure out how to track that and put people in a process that could lead that to disenrollment. So this is a lot of thinking that the department has to do. And of course, that does not, that is all very different than the experience that regular people who would have to comply with those requirements would be thinking about. Just as an example, because we have heard many lawmakers say, well, because we put exemptions in the bill for these requirements, they are trying to claim that that protects vulnerable people. And we have consistently said, well, there's always, whenever you set an exemption, there's always people who fall outside of that exemption or can't prove it. It becomes another barrier for people. And one example of this is the category for caregivers. Caregivers are exempted from work requirements, but the language is parents, guardians, or relatives of a person with a disability. And when you think about that phrase, it sounds okay when you first read it, but then if you are a person with a disability who has an unpaid caregiver who isn't a relative or a guardian, that person wouldn't be included in that exemption. If you are a caregiver of a person who is an older adult who is not a person with a disability, which is the case for an awful lot of unpaid caregivers, this definition may not apply to you. So there's an intent to exempt caregivers that doesn't include all caregivers. And even if you do meet the criteria for that exemption, now the state has to figure out a whole bunch of ways for you to prove that you meet that exemption. So some of the questions that the state would have to answer is, okay, well, if you are a caregiver, what do we think qualifies you as a caregiver? Are there certain things that you have to be doing? How many of those things do you have to do? How do you prove or document that you're caregiving? These all become hugely important questions that will determine if people who are doing a lot of unpaid caregiving work now, if that work counts enough to be included in this exemption. And this proving this exemption becomes another piece of something that you always have to do as part of renewing or applying for Medicaid. There are lots of groups of people that states are going to have to figure out who fits in what category. And we think that there are some groups of people who are in Medicaid now that may have a harder time proving that they're exempt. And I list some of them in this column here. A lot of people with disabilities are actually in Badger Care, which is usually considered the able-bodied Medicaid program. But there's an awful lot of people with disabilities and a lot of low-income older adults who are in Badger Care. And some of them may have a harder time than others in having the documentation, whatever it turns out to be, to say, hey, I meet an exemption criteria. And if they don't, then they have to meet the community engagement, the work requirements criteria. All of this is a long way of saying that changes that are adding a lot of paperwork, a lot of process, a lot of do you fit or don't you fit with an exemption or not, and depending on whether or not you fit means you have to do very different things. These are all ways that you achieve savings when people can't go through the process, right? And all of that extra process and paperwork increases the chances of mistakes, either clerical errors that the state makes or people making mistakes. And what would be true is if the bill passes in its current form, most Medicaid and SNAP participants are going to experience more paperwork and more hoops than they do now to get in or stay in the programs. You are a group of people who, many of you have been in Medicaid programs. Some of you may have had mistakes happen now. So you're in a really good position to kind of understand the consequences of what happens when somebody makes a mistake. And it could be a mistake, that the state makes or a provider makes, or, there's a clerical error. If you think about, has something ever happened that has accidentally changed the level of services you receive when it shouldn't have? Has a worker been over or underpaid? Has the paperwork that you needed been sent to the wrong person or the wrong address? Have you accidentally been disenrolled from a Medicaid program? That actually happened last fall. There were a number of people in MAP, and they reinstituted a premium, or tried to, and the system wasn't able to handle all of the requests at the same time. And so there were lots of people who had tried to pay, but the system didn't record them as paid at the right date, and they were kind of automatically disenrolled. And it wasn't that their eligibility had changed or they hadn't paid, but the system didn't record it in time. And so automatically there were people who lost coverage. Those are the kinds of mistakes that if you've had experience with them, that can be very valuable for lawmakers to hear that in the current system, when things happen, they have really big consequences for people. And sometimes, the paperwork that people have to do now is pretty time consuming, and it's intense, and there's lots of folks that need help doing it. If you've made a mistake that has had to be corrected in some way, this is another good experience to share with lawmakers of, this is what it means now, and you're asking states to add more and more things for people to do that are time sensitive and need to be done right, let me tell you what happens when something doesn't go right. If you get a service denied, if you have to correct a mistake, how much time does it take you? How many phone calls? How many hours? Have you experienced a delay in care and coverage? And what does that mean for you? Have you lost workers while you're waiting for somebody to approve paperwork? These are all things that we have heard about from people just like you. And I think it's important to kind of raise those experiences and say, look, if these things happen now and have a big consequence on people's lives, adding more things that have to be done right is going to increase the risk that more kinds of experiences that I've already have will happen in the future. The other thing that I think you as a group have a lot to say about is a lot of people say that the current system we have, all of the different paperwork and forms and different things, it's hard. It's hard to understand, and there's a lot of people that need help to do it correctly, including a lot of help from unpaid caregivers. So adding and making things harder or more complicated increases the challenge for those unpaid caregivers to be able to do help somebody do that work correctly. And there's also an awful lot of people who maybe they're able to manage now, but that might not be the case in the future. And adding more things to do will make it harder for them to do it correctly in the future at great consequence to them. A lot of people who are unpaid caregivers now may also not be able to continue doing that level of work, or people may lose the supports they have, which could really be a problem in maintaining coverage, because these administrative requirements continue as long as the person has a need and is eligible to be in Medicaid, even if the supports around them change. Okay, so again, you can see by my title that I missed another revision here. The House has voted, so now we can react. You don't need to be prepared anymore. You could be all ready to go. Already this morning, lots of disability organizations in the state are preparing and putting out statements about what they think about this bill and the vote. We've been talking about some of the ideas that have been proposed for the last several weeks since the Energy and Commerce Committee made them public, I think 3 weeks ago, maybe it was 2 weeks ago. So you're already familiar with, here's the package of ideas that they're proposing, the scale of Medicaid cuts that they're proposing, and you know what it means to have less money coming into the state for Medicaid, and what it would mean potentially for you or your business if these ideas become actual law. So if you are connected to local disability or other organizations in your community, or there are community groups in your organizations that have been following these issues or serve a lot of people who are low income and maybe on Medicaid, this is a great time to reach out and ask them to do a statement. And it doesn't have to be long. It can be like a quote. It can be a few sentences or a paragraph. But the idea is that many reactions from people with lots of different perspectives all at once sends a pretty big message to lawmakers that these ideas are impactful and not very popular. And I think that's really important because, again, even though the House has passed this bill, the Senate is now watching for what do people think about it, and they have the opportunity to make changes. These cuts they are going to have an across-the-board impact on all states, including this one. They aren't solving any of the problems that Congress claims they want to solve, and they certainly don't improve Medicaid. So those are all some big themes that you could put in a statement. Um, this is actually an idea that a member of the grassroots, just like yourself, had. Lots of you have been communicating pretty constantly with our federal lawmakers, some of you since January, about Medicaid cuts. And you have heard a lot of different things over those weeks. And sometimes you keep hearing the same thing, even when you have provided information or said, no, I don't think that's right, or that doesn't match my experience. So one of our grassroots folks said, I've gotten a letter from my lawmaker and it has all of the things that they keep, it's a form letter, and it has all of the things that they keep saying that I keep refuting. And her idea was to just take a red pen and edit that constituent letter and write down, circle the phrases, and write down exactly why they don't match the lived experience or are not true. And you could send an edited letter like that to your local press. Many of you have tried for a long time and for many times to get in touch with your lawmaker or have meetings or have phone calls or have actual discussion. And a lot of you have reported back that, hey, I haven't been successful in getting some time with my elected official to tell them about my concerns, or if they've heard it once, then they don't want to hear it again. And I'm looking at the ideas in this bill, and they don't reflect any of the concerns that I've been talking about and that I know other people have been talking about. So it's not only a good idea to send the letter to your corrected letter to the press, but also talk about the efforts that many constituents have been making, including yourself, to try and say, hey, these are the things that are not true. They're not matching our experience. And we think that the ideas in this bill are going to impact and put us at greater risk as a strategy to hold your lawmakers more accountable. You can also take a picture of your edited letter, post it on social media, make an explainer video. The more that we kind of elevate and amplify voices now, the better it is. And I know that lots of you have been doing that work very consistently over months, but it's really, really important to send a very strong message to the US Senate that the ideas that the US House approved are really, really unpopular with lots of people who live with these programs or are touched by them. And it's also really important now that the House has passed something to let as many people know what is in it and why you're concerned as possible. I will share that I was meeting with some of our state lawmakers this week, and they were asking questions, and I was kind of sharing here, just like we do together every week, sharing like, here are the things that are in this bill. It's a big bill. It's more than 1,000 pages. I can forgive them for not having read all of those pages. And I'm only kind of going into parts of this bill. There's a lot of different things that are in there that aren't necessarily related to Medicaid and SNAP, but they really didn't have a clear sense of, oh, that's what's in there. Oh, that's what it means. So just understand that even though you're an expert, expect that people around you don't really know necessarily the contents of what has just been passed or how it would impact them. And you can play a big role in helping spread that information. So next week, lawmakers are home. We talked last week about making a plan. There's still time to make a plan. Maybe your lawmaker is going to attend a Memorial Day parade. I don't know. Lots of times this is a time when lawmakers like to do community events. So maybe you'll run into your lawmaker somewhere. Maybe they have an event schedule on where they're going to be. Even if you don't run into them on the street and have the opportunity to talk with them or, line a parade route, you can reach out to them and ask for some of their time, either their time specifically or some of their staff time. So the same approach of, can you invite your lawmakers to your home or to your disability organization or to meet with a cluster of families to talk about, your concerns about this bill and, think about some of the things we've talked about today. That's a great strategy. Many of you have done drop-in visits at in-district offices. Now we know that the House has passed this bill. We know how our delegation members have voted. If you live in an area that is represented by a Republican member of Congress, you know that your member of Congress voted yes on this bill. And if you live in an area represented by Democratic members of Congress, you know that they voted no on this bill. So that becomes a new discussion point to talk about, right? You can now talk about how they voted, ask them why they voted that way. Say your concerns or your support for how they voted. And if they're not in their in-district office, again, come prepared to leave something of yourself behind and take a picture and make sure that other people in your social world know that you were there. Even if you get no response, because that has been a more frequent strategy for lots of lawmakers, is that they are no longer responding to constituents. Even some of their town halls have gone to invite only and been very much pop-up, like maybe there's a call that somebody gets to participate in almost real time. That's a new strategy, and it is designed to keep the group of people that they are interacting with known and fairly small. So even if you don't get a response, it's important for lawmakers to get a lot of asks so they know constituents are watching and know how many constituents are watching. If you're an organization, again, especially if you have a place of business, you can invite that lawmaker to your business and talk about how it would impact your business and workers and clients, and how the issues that you see in Medicaid are not solved by these cuts. So what these cuts mean is pretty simple. These are choices. We've chosen to reduce the amount of revenue coming into the government in forms of tax breaks, and we've chosen, and the bill has chosen who those tax breaks benefit the most. And they've also chosen what cuts to make. They could have made different choices. So it's important to kind of remember this whole bill is a choice. These cuts don't solve the problems that many of us who live with these programs would like to see solved. They don't improve Medicaid. They don't improve the coverage that people have or solve the caregiver crisis or improve or change the kinds of services that people want and to stay in their homes and their communities. They create new problems for states that will cost people their Medicaid coverage. And everybody who loses Medicaid coverage or can't get it will be worse off as a result. So you have been the group of people that has been really on the forefront saying, hey, this stuff matters. You're still needed on that, as we continue in this process. You absolutely know what it means if you have less help than you do now. And it's really time to make sure everyone else knows too. You don't have to be shy, not that many of you were, but I think it's time to get less and less shy. And you've been so giving of your personal experiences in ways that nobody should have to be, quite frankly. And we certainly have, you certainly made a huge difference in terms of what this bill looks like. This is a day, excuse me, when it's easy to feel like perhaps we haven't we haven't, excuse me, had a victory, but we actually have, because your work, like the ideas that we were talking about, that Speaker Johnson thought that he was going to be able to pass in late February, were really, really more impactful. Per capita caps, block grants, some of the ideas that we were talking about early, several months ago, they have become ideas that are not in this bill. And that in itself is a victory. So while there is a lot of impact in this bill and a lot of ideas that will impact people in Medicaid and SNAP, it is not the worst case scenario that we were worried about in January or February or even March. It's much less than that. And your advocacy has been the reason why it's much less. And the other thing to remember is no cuts have happened yet. This is the time where we push harder and are louder to influence the US Senate to make different choices. So while this is a moment where the House has passed something that has many ideas that are impactful to our community, we are not done with this yet. We've already had significant wins. And in the coming weeks, our task simply changes to influencing the Senate and seeing how many of the things that we do not like, we can get removed from this bill, and that can happen, or change so that they become less impactful to the people that we care about. And with that, I am going to stop presenting and take any questions if there are things that have not been answered already.